Welcome to OnlyVet. In this video, we will discuss anthrax. Anthrax is a bacterial disease which is caused by the bacteria Bacillus anthracis, which is gram-positive spore-forming bacteria. The bacteria in the aerobic condition has capacity to produce spores, and those spores are infective form of the bacteria. When it comes to the epidemiology of the anthrax, it is distributed worldwide and it depends on the type of soil and the climatic conditions where uh, those climatic conditions like temperature more than 15 degrees Celsius and relative humidity around 60%, these type of climatic conditions favor the formation of spore, and wherever climatic conditions like temperature more than 15 degrees Celsius and relative humidity around 60%, that favors the formation of spore and ultimately leading to the more percentage of the occurrence of the disease. In such areas, we refer it as the anthrax belt, and based on these climatic conditions like temperature and relative humidity, we can even predict the anthrax year. And anthrax belt is nothing but it is an area where anthrax has its endemic form of the disease, and it depends on the soil type and the climatic conditions, and that area we can also refer it as the incubator area. And mainly it is occur in tropical and subtropical regions wherever the high rainfall and the temperature around more than 15 degrees Celsius and relative humidity which may be around 60%, that will facilitate the formation of spore, ultimately leading to the enhanced occurrence of the anthrax. The areas where such type of increased intensity of anthrax, we referred it as anthrax belt, and even we can predict the anthrax year. This is about the epidemiology. Now let us come to their transmission. The major route of transmission is like through by the contaminated feed and water, even infected soil containing these spores, that will be the major cause of transmission. And sometimes it is noticed that tabanus and stomoxis flies act as the mechanical vector of these Bacillus anthracis. And in case of human beings, the inhalation form of the anthrax noticed more common. Now let us come to the pathogenesis. Mainly in case of pathogenesis, susceptibility of the animals. When it comes to susceptibility of the animals, cattle and sheep are highly susceptible, whereas dog, cat and rats are quite resistant to anthrax. Now in the pathogenesis, the bacteria enter the body. It may be through ingestion or inhalation, and after ingestion and inhalation, it will reach the regional lymph nodes where it multiply, and through the lymphatic systems, it will enter the circulation, and where they will produce their toxins leading to the septicemia, and those toxins will invade the all tissue and organs, ultimately leading to death. The causes for the death involves, there are mainly two theories for the death region. The theory one is log jam theory, where it is believed that uh, the mass of bacteria will block the capillaries, ultimately resulting into the anoxia for the cells of the host, leading to the death of the animal. This is one theory, that is log jam theory, and another theory called based on the toxins. And recently, the studies have shown that the organism Bacillus anthracis will produce the potent toxins, and that will affect the central nervous system, and leading to the formation of edema and tissue damage, leading to the shock, and ultimately leading to the death of the animal. So those potent toxins involved, they are classified as factor 1, factor 2 and factor 3. Factor 1 as edema factor, factor 2 as protective antigens and factor 3 as lethal factor. As the name itself suggests that edema factor will leads to the formation of edema, and the protective antigens, those antigens which helps the bacteria from the phagocytosis by the macrophages of the immune host of the immune host, and the lethal factor which finally leading to the death of the animal, which caused the death of the animal. And also the organism got one more important characteristic, the organism able to produce fibrinolysin, which liquefies the fibrin. Hence the blood clot mechanism is disturbed. Therefore whenever there will be a case of anthrax, we can notice that the blood will ooze from the natural orifices without clotting. And one more thing is that in the anthrax there we cannot notice the rigor mortis. Now, let us come to the clinical signs of the anthrax. The incubation period of the disease ranges between 1 to 2 weeks, and the clinical signs, based on clinical signs, it is classified as per acute and acute. In case of per acute, there is sudden death without noticing clinical signs. There will be fever, tremors, dyspnea, and a congested mucous membranes will be there, and the animal will collapse within a few hours, and there will be convulsions and death. And the main point is that the blood will be oozed from the natural orifices, and that will be unclogged tarry colored red blood. And in case of acute anthrax, there will be raised body temperature with marked anoxia and depression, and rapid and deep pulses will be there, and increased heart rate and respiration rate will be noticed, and congestion and hemorrhages will be seen, and reduced milk yield in the milk giving animal. And in case of GIT, there may be diarrhea and dysentery can be noticed, and edematous swelling of the throat, flank, and perineum region can also be noticed. And in case of acute condition, the death of the animal occurs within 2 days. And mainly, now let us come to the necrosis finding. Mainly, it is suggested that in case of anthrax, we should not go for postmortem examination, but the reason for the avoiding the postmortem examination is mainly that the infection from the spore, the chances of getting infection from the spore is high whenever we will cut open the carcass. That might lead to the entry of the spores into the environment, leading to the mass infection in case of human beings. And those spores of the bacillus anthracis, those can be used as the biowar technique. Now, the findings of the necropsy involves the rigor mortis is absent, and bloat and putrefaction is very fastly noticed in those animals, and the marked enlarged spleen will be there. It may be 5 to 6 times more enlarged as compared to the normal spleen, so it is referred as a splenomegaly. And the important point is that there will be unclotted blood filled or flows oozing through the natural orifices. These are some of the points we will get in the necropsy findings. And when it comes to the diagnosis, based on history, is that whenever we will notice the sudden death of the animal, we may consider it as the anthrax, and it is the one of the option to suspect it as anthrax. And when it comes to the lab demonstration of the organisms, the sample will be collected from the piece of spleen or the ear vein. And the point we have to keep in our mind is that collect the sample as much minimum we will be able to collect, so to avoid the formation of spore and contamination to the environment. And so it is suggested that just take the sample from the ear vein and make the smear and go for the gram stain or any methylene blue stain where we will get the gram positive organisms. And it is in third point of diagnosis where we can culture the organisms. So we can use the gelatin tube where we can get the inverted fur tree appearance, and gelatin tube containing the nutrient broth where we can get the inverted fur tree appearance. And in the blood agars where we will get the colony of the organisms as medusa head and curled hair, bamboos rod, and judge's wig, and spiked up ear. These are some of the characteristics of the colonies where we will culture the organism in the nutrient agar or the blood agar. And one more biochemical test, that is serological test, is the Ascoli's preparation test, where we will take the piece of ear or spleen and we will mince it, and we will boil for 2 to 5 minutes. Then we will cool. Then we will after centrifugation, the supernatant we will collect in a test tube and we will add the antisera for that supernatant. So after adding the antisera to the supernatant present in the test tube, there will be a result in the formation of white ring. If that white ring between those antisera and supernatant junction, the formation of white ring noticed, and such the animal where we collected the sample will be tested as positive for the anthrax disease. And when it comes to the treatment aspect, it will be referred to the authorized veterinarian. And penicillin combined with the streptomycin, it is available as the dextrosine can be drug of choice for the treatment of the anthrax disease. So this is about the anthrax. In next upcoming videos we will be covering other bacterial diseases. And some points we left in this anthrax, that in case of prevention and control, in the earlier starting of this video we established that these bacteria, bacillus anthracis, are aerobic bacteria. So uh, to prevent and control the disease, the main point is that isolate and quarantine the newly entering animals to the shed and herd, and no postmortem examination is suggested. So we have to burn or bury the animal, and during burying we have to use the calcium carbonate, and those limestone, the calcium carbonate is nothing but the limestone which react with the carcass, thereby producing the carbon dioxide. So as we earlier noticed that these organisms are aerobic bacteria, whenever we bury these animals with the limestone, these limestone react with the carcass, leading to the formation of carbon dioxide. So anaerobic condition will hinders the formation of a spore. Ultimately we will prevent the further infection because of the spore formation. This is about the prevention and control aspect. And some anthrax spore vaccines are also available. And the major important point is that we can educate our rural mass regarding the anthrax, so we will be able to prevent and control the disease in a further more efficient way. This is about the anthrax disease. Thank you.